Hi, so today we're going to be talking about the truth in finding treatment for HIV. The epidemic of HIV has been going on for many years, and it is a major health problem for many. So let's start off by asking, what is HIV? HIV stands for Human Immunodeficiency Virus, which is a virus that attacks the immune system so the body is unable to fight infections. There is currently no cure for HIV. Fortunately, we have seen a big change over the years, so let's go back in time for a moment. In the 1980s, an unknown infection, later being known as HIV, caused many men to be left abandoned in hospitals because researchers thought this infection was being spread through sexual intercourse between two men. During this time, being homosexual was very frowned upon, so many people did not want to be near these people who were infected. This led to all men who were infected to become stereotyped into being homosexuals, isolated in hospital rooms, and eventually being left to die. Then research finally came out, and we found out that it is not only homosexual men who can get this virus, but really anybody can. So how is it spread? So someone can contract HIV through bodily fluids, needle sharing, mother-to-child transmission, and sexual intercourse. This is a pretty big list compared to the 1980s. So even on a simple accident, it can be transmitted. For example, a medical professional accidentally poking themselves with a used needle of someone who already has the virus. The best way to avoid contracting HIV is to use preventative measures. So some preventative measures are to always use safe sex practices, especially if you do not know your partner's STD history, if they've had any recent testing. Another one is to make sure that you're getting your yearly checkups, getting your STD testing just to make sure everything is good. And then always handling and disposing of bodily fluids with caution and protection, using gloves and goggles when needed, and always handling needles properly, never recap a needle. And then always disposing them in a proper sharps bin or biohazard bin. These are the best ways to protect yourself from contracting HIV. So treatment. So there really are a few treatment options. They may not be too effective at this time, but there are options. So let's start off with someone who is at high risk for HIV but has not been diagnosed with HIV. So the daily antibiotic is called pre-exposure prophylaxis. So it's better known as PrEP. So this is a daily oral antibiotic that is a good option to prevent the transmission of HIV. For someone who does have HIV, though, there is a therapeutic vaccine. A person must be HIV positive in order to qualify for the therapeutic vaccine. The goal of the therapeutic vaccine, according to research Science Daily article, is to introduce antibodies to the body to allow it to recognize it in the future to further prevent more antibodies from producing and eventually slow down the infection. So this article from Science Daily titled "A Chain Reaction, HIV Vaccines Can Lead to Antibodies Against Antibodies" is a great resource to learn about this vaccine. It talks about the importance of finding a way to prevent the antibodies from producing, but also the problem within it as well. The body can get used to the antibodies that are going in, which leads to production of the harmful antibodies again. After 2 or 3 doses of the vaccine, it did stop binding directly to the virus because the immune system recognized these antibodies. This leads me to the next slide, where other issues have arisen in the production of finding a cure for HIV. So some other issues when it comes to HIV, the CD4 plus T and B cells are the white blood cells that reproduce, causing the virus to spread. This leads to overpopulation, which causes the cells to not function properly. PLUS.org released an article titled "Fluctuations in Blood Marginal Zone B Cell Frequencies May Reflect Migratory Patterns Associated with HIV-1 Disease Progression Status." That's about the B cells overpopulating, leading to not knowing why this is happening. And this is making scientists have a very difficult time finding a cure for HIV. However, they are working on a long-acting preventative. So the National Institute of Allergy and Infectious Disease has actually begun clinical trials using these long-acting preventatives. So if you look at the chart, we are looking at 4 possible long-acting preventatives that are currently going through a clinical trial for research. So starting off with the intravaginal ring. So the polymer ring inserted into the vagina releases an antiretroviral drug over time. So this over time will allow the body to develop the proper antibodies to not develop HIV from their partner or the people that are just generally at high risk. So another option is an implant. So this is like a device that's implanted into the body that releases that same drug. And then we have the injectable, which also inserts that drug into the body. And then lastly, the antibody. So the antibody is infused or injected into the body to hopefully allow the body to get used to the antibody to prevent the HIV risk. So there are currently no results to the clinical trial, but there are many people who are currently enrolled in it, so hopefully we will have some results soon. Then moving on, a person who is given the preventative tool cannot contract HIV specifically from the tool itself, so this is a great start for a trial and error study. So the trial and error when it comes to medical fields, especially when making something new, there can always be an issue with that. So starting off with immunity, it's always a possibility because the body is capable of becoming used to it, which may lead to the body not responding to the medication. Then rejection is a big one because the immune system can reject the help it needs, which may make a person have severe side effects to any medication given to them. Then we have cost. So cost for anything medical is always an issue, especially when it's medication. Some insurance companies will not cover the whole medication, which can cause people to pay out of pocket, which later will create financial worry. And then other people who do not have medical insurance at all may not be able to get the medication, which would be very useless for them. Then supply shortages have been happening all over the world recently with a lot of medications. So if someone's relying on their medication to take daily, this could be a really big issue for them and create a long-term effect. And then to conclude, the ongoing research of HIV will hopefully end all of the many years of suffering and stereotyping one day. The research shows that some resources will be available in the near future, and they are doing everything in their power to find the best way for the immune system to fight this virus. It is so important to keep researching this because of all the lives that were lost in the 1980s due to the lack of knowledge. Personally, I did not know that there were current clinical trials going on with the preventative tools until I did my research. I find this really interesting to prevent the spread of HIV. However, I do think that finding a cure is a more effective way to do research, but I do know from doing my research that it has been really difficult because of the antibodies in the body and the way it fights. I do think that it is very important to try and get this figured out one day in the near future, just because of everything that has happened in history with this virus. So many people lost their lives, so many people were abandoned. It's really sad when you think about it like that. So I do feel strongly about this, and hopefully one day we will have a cure. Thank you.